A Self-Advocate's Guide to COVID. Adapted from Green Mountain Self-Advocates. What is COVID-19?
COVID is a virus. There is more than one type of COVID virus. Different types of the same germ are called variants. Some variants of COVID are easier to catch than others. It is spread through the air by people who have COVID. People with COVID can look or feel sick, but sometimes they do not.
How do you get it?
You get COVID when someone with COVID gives you their germs. When they cough or sneeze, their germs get in the air, on you and on things. Germs get into your body through your mouth, nose, and your eyes. Not all germs give you COVID. COVID-19 particles look like this under a microscope.
How can you lower the risk of getting COVID or other types of sicknesses?
Visit with people outside instead of inside. Being outside greatly lowers risk of getting COVID. When inside, do not stand or sit too close to others. When inside, wear a mask if you are with a group. Indoor places with lots of unmasked people are at high risk of spreading COVID. Fresh air helps get rid of germs. Use air purifiers in indoor settings like your home or office. Get your COVID vaccines and boosters. Vaccinations lower risk of going to the hospital or dying if you get COVID. Keep your hands clean. Your hands touch germs and can make you sick when you touch your face. Wash your hands a lot and use hand sanitizer.
Why do you need vaccine shots? What is a booster shot?
After your vaccine, you can get an extra shot called a booster. You can get a booster every 6 months. Over time, your body needs more of the vaccine to keep fighting off the virus. For example, you get a flu booster shot to keep you safe from the flu every year.
What if you are around someone with COVID?
Take a COVID test with a healthcare provider or do a self-test at home. You can get a self-test at a pharmacy. Stay away from others until you know if you have COVID or not. Keep track of how you feel.
Keep track of how you feel. If you feel sick, here are a list of symptoms.
Fever, headache, runny nose, tired, coughing, lose your sense of smell or taste, hard time breathing, sore throat, body ache, chills, an upset stomach, nausea, or diarrhea.
How do you get a test?
Medicaid covers the cost of COVID tests. Call your healthcare provider. They can help you find a free test.
Contact the Disability Information and Access line to learn more about COVID. Call 888-677-1199 or visit daleacl.gov. What happens when you get a COVID test?
A COVID test at a healthcare provider's office. A healthcare provider will ask you some questions about how you feel and if you have any COVID symptoms. This person doing the test will take a swab, which looks like a long cotton stick. They will put it in your nose, but not very far. It might tickle or feel a little weird, but it should not hurt. You may have to wait a little while to get the test results. A doctor will call to let you know if you have COVID. A COVID test at home. Wash your hands, make sure you have everything that you need to take the test, a test kit, a timer, and a place to throw your used test away after you are done. The test kit has instructions, a swab, a test, and a tube with liquid. Follow the instructions. If the test shows that you might have COVID, call your healthcare provider.
What do you do if you test positive for COVID-19?
Testing positive means you have COVID. You must stay home and isolate yourself. Isolate means stay away from people you live with. You must do this until you test negative. Stay in your own room away from others. Do not eat with others. If you share your room or home with other people, always wear a mask. Stay at least 6 feet away from others. Crack open a window for fresh air if you can. Tell your healthcare provider you have COVID. There is medicine for people who get COVID, but sometimes you may not need it. Tell people you have been around that you have COVID. You might feel embarrassed. You still need to tell them. The virus is very easy to catch. People will not be mad at you.
After 5 days of isolating, do another test. If it's negative, you can be around other people without a mask. If the test is positive, continue to test until negative.
This guide was brought to you by the Inclusive Healthcare Partnership Project, created by the Vermont Developmental Disabilities Council.